Hello, hello.
Hi.
Hi, everyone. So, we all know April is Autism Awareness Month, and my name is Unospio Mkize, and I'm the founder of the Neurodivergent Gift. Today, I am in conversation with Bohlale, and she is the founder of Autism Society, but she'll tell us more about herself in a bit. So, I just want to first, let's paint the picture. Let's give the context of why are we doing what we are doing. So April, being Autism Awareness Month, gives us an opportunity to really have good conversations that allow us to build community, allow us to educate each other, but also allow us to give us a little bit of tools in our bags as parents and caregivers of children with autism on how to navigate the space. The space that can be scary at times, the space that can be confusing at times. And when you get into the space, it's often you think to yourself, I'm alone in this, and I'm not quite sure what I should be doing.
No one's been through this before.
Where do I go with this? And so really the purpose of these conversations is for us to start talking about the tips and tricks and things that can help us along the way as parents and caregivers of children with autism. So this month, we're going to start the journey of these conversations, and we really have a couple of topics that we want to step into. The topics really around the therapies, because I think that's a big part. When you are a parent to a child with autism, what are the therapies that are out there? What should I be thinking about looking at? We're going to talk about the educational system, because at some point, my baby needs to go to school, and I'm not quite sure if he's not already in school. And where do I even start? There's the mainstream versus non-mainstream. There's schools that say that they are diverse, inclusive.
That's
what does
word.
That actually mean? And what should I be thinking about as a parent? So there are all of those topics that we'll be diving into. We'll be looking also into the medical space. How do I find a dentist, a doctor, even a hairdresser who actually understands what it means to service a child with autism? What are their specific needs? Therefore, how do they make the child comfortable, but also the parent? Because there's a panic also that you go through in a sense of, will they understand what my child needs? Will they listen and give, and when my child hasn't given consent to be touched, but we still need to get this thing done, what then? So we're going to be exploring all of these things as we have our conversations. But today, I want us to start having a conversation around the therapy journey and all of those things. So I think that's the first thing that as parents, we kind of step into, we kind of click into, is that I need help. And generally it's around the therapy space. So sitting with Bohlale today, she has been in my world for the last, it's going to be 4 years in June. 4 years in June, and she is my son's speech therapist. And I think as we stepped into this world, your ability to paint the picture for us and give us a sense of direction, but also allow us to have the most random conversations, because you're not quite sure what I can, what I can't say. You're not quite sure, is this even something I'm meant to be mentioning? But the space that you were able to create for us allowed us to start seeing that different things that can be added to this. So really, today, I would love for us to have the chat around just the therapies, but obviously focused on the speech therapy aspect, because that's where you sit. And just the journey of what does it mean? What does it look like? What should parents be thinking about? What should they be asking? How should they be advocating? All of these things. So just to get us started, who is Bohlale and how did you even land up in this space?
I'm going to give you a very short response to that, because the story is very long. But yes, so guys, welcome. I am Bohlale Mulebeledi. I'm a speech therapist. I used to say, I'm a speech therapist and I treat everyone from birth to death. And then I realized a few years ago, no. While we can treat everyone from birth to death, I really prefer the pediatrics. So I'm a speech therapist with a special interest in pediatric speech therapy, and with a special interest in multilingualism and a special interest in neurodiversity. And that's another buzzword that's used a lot now. Now everything and everyone is neurodiverse, and every school is inclusive, and but we will unpack that as the conversations go. And I'd love to say I chose to work with autistic children, or I chose to work with children with ADHD, or I chose to work with children with dyslexia or apraxia. I mean, now I can say I chose to because I stay seeing them. But they honestly chose me. And it started in university, where I was placed at a school for children with autism in one of my pracs. And then in my community service, all the children that I ended up with were neurodiverse. I never just got a pure stuttering child or a pure speech delayed child. No. I always got the children with complex communication needs. And that's the stuff that gets me up in the morning, where I try to figure out what is going on in this child's life. And so I think because I was always willing to take on those kids and I, was always trying to figure them out, my reputation started getting bigger. My reputation started getting bigger and louder than I was, and I'm already quite loud. And then after my community service, I worked a little bit. And then I was just getting calls left, right, and center. Will you come and deal with autistic children? Will you come and treat autistic children? Will you come? Will you come? And then eventually, they stopped asking me to just treat autistic children. I was invited to work with non-autistic children. They just said, we need a speech therapist. Come. And obviously, guess who found me? Autistic children. And that is even in, mainstream spaces. I'm going to put mainstream in inverted commas because what is mainstream, right?
Yeah.
But for the purpose of this conversation, even in mainstream and spaces, all the neurodiverse children would find me. And so I was like, there was clearly, and I speak about anointing, I'm a believer, I believe in God, and I really speak about anointing where I say, there's a special call on people who work with autistic children. You can't just walk into the space.
Yeah.
One of the things I love the most about autistic children with ADHD, just neurodiverse children in general, is how intuitive they are. And if you are there for the wrong reasons, they will make it known instantly. Yeah. And so there's this call on people who work with neurodiverse individuals. And I think when you respond to that call, we always talk about a magnetic force. Yeah. They just find me. They find you. Mm. And so, so that's how I got here. I don't even know how you found me.
I can tell you how I found you.
I don't even know.
So when Ollie was 2.5, we then said to the teacher at the school, something's not right.
Yeah.
I get that you shouldn't be comparing your kids to other kids because every child develops at their own pace. But I still believe in comparison just to see from a sense of, am I on the right track?
Yes.
So that for me is how I use comparison. Am I on the right track? Not they are meant to be at the same starting line. They all are different starting lines, but at least are we on the same race?
Yes.
We're going in the same direction. Teacher said, let's just wait until he turns 3 and let's just see. He turned 3 and I made the decision. Then I was like, nope, something doesn't make sense. I still didn't know what it was.
Yeah.
And then I remember, so I'm a part of this mommy group on Facebook. And I remember just putting out there, I'm looking for a black speech therapist. And I was very specific on black speech therapists because there's the whole dual language aspect.
Yes.
And I don't want to be told, stop teaching him your home language because this is the thing that's actually impacting the speech delay.
And that happens a lot.
This is the thing.
That happens a lot.
So by stepping into a space with a black speech therapist, when you tell me it's actually the dual language that is impacting, I know though that we've gone through the due diligence of actually
You're not always going to be asking. You're asking yourself and doubting the credibility of the advice. You're right.
The thing. Yeah. And also, I always think to myself, but I'm a dual language kid.
Yeah.
So I picked it up. So
yes, your husband is.
My husband is. Everyone else
in your world
is.
Yes.
And then that's where your name popped up. And I think it popped up 4 different times on the group. Oh, really? And then I was just like, okay, let's give Bohlale a call.
Yeah.
And then that's how I actually found you.
You were in a different town. I remember that as well. You're in a completely different town, and completely different town. And we were nowhere on the socials.
No,
and
not
nowhere
at all.
on.
You were also not on socials. So they gave me your number also within that space. And that's how I found you. Yeah. So yes, they do find you. And you were speaking about anointing.
Yeah.
And I honestly believe in that, especially when you're dealing with humans.
Yes.
When you're dealing with the human soul, you have to step into that space knowing that you're called for this. Because there's such a much deeper impact that you have, and not necessarily just to the person that you're actually dealing with. So not just my son.
Yes.
Your anointing then flows into the family context because you are purposed to be there. There's something that you're carrying that allows everyone else to know that God sees them.
Yes.
And that's always my biggest thing, is that when we are placed in spaces where we have to hold a human soul as part of our daily work, always ask yourself, is this what I'm called to do? Because there are days when you won't be able, your physical body is not going to want to show up.
Yes.
But because you're called into it, you're able to continue to show up. So I just wanted to say
light. And it's light work. I think people hear the word autism and they hear ADHD and they hear dyslexia and all the Xias and the graphias and and they think, wow, I can't even pronounce that word, what does it mean? And then it always looks so hard. Yeah. And those are the conversations that I've had with moms, where they're like, is this going to be my life?
Yeah.
It's so hard.
Yeah.
Like I love my child. Don't get it wrong.
Yeah.
I love my child, but this looks like a very hard life. And I really didn't sign up for this hard of a life, And I think when you work with autistic children and when it is enjoyable, it makes work light. And I think that's what parents feel, when you also feel carried. And that's what you were talking about. You also feel carried. Well, you're like, your kid bit me. Obviously. I don't want to be bit. I do not want to be bit, But I know the feeling, whenever the child has like an incident. I once had a child put his hand into his diaper and, pull out feces. And I always look at the parents first because it tells me, have I created a safe space where the child can be who he is? Obviously it is inappropriate. Obviously it is socially unacceptable. Obviously it is something that needs to be worked on, But I always look at the parent first, and the parent always, they are distraught because that's my child. That's my child, and that is the most heinous thing I can imagine a child doing. And Auntie Buhlali is here helping, and when no And the second I can say to a parent, it's fine. Yeah. Because it is fine. Because I know this child's not malicious, Obviously I don't want to be smeared as I don't want that. But sometimes it happens. And I think when we can show parents, I'm okay with it. Yeah. This is the world we're trying to create, where we can say it is inappropriate, it is gross, but for this child's not malicious, and both things can be true at the same time, and to also have that perspective of, okay, so now there is poop in a carpeted room, it is 11 o'clock in the day, and I am back to back until 5. So cleaning has to happen. Why do we not change the session into a cleaning session? Yeah. Because this child needs to learn to clean. Yeah. What was the question again?
And I think that's the thing for me, which I appreciate about how we are carried as parents through your practice, is that any situation is an opportunity for learning. Yes. Because that question of, is this my life? Will this child be able to understand how to function in the world, how to engage with the world? What is socially right or wrong? And those are the questions actually that we battle with. Is that, will my child be able to actually basically acclimatize into this world? Will they be okay?
Or will they always be dependent on me as their parent?
That's the thing. So when moments like that happen and you're able to bring them into your session, it helps that moment of being carried. So the question that I want to ask now is, what is speech therapy and how does it look like through the lens of autism?
All right. So speech therapy is a very minimalistic, we're in minimalism era now. Are we still there? Are we still in the minimalistic era?
I've never liked it.
Oh. I'm not usually into trends. But, it's such a minimal, it's such a reductive word for what we do.
Okay.
What's a reductive term or a phrase or a clause? No, it's not a clause, phrase for what we do. Speech is literally muscles, movement, and the sounds that the movement of muscles creates.
Okay.
So everyone who's listening to this video right now is hearing speech, right? Okay. So if I say sk, that's speech. But if I say cats, you can hear cats. You're hearing speech. But your brain uses language to decode the meaning behind the sounds that my muscles are making. And so we always speak about, I'm a speech therapist, and I'm like, oh my word, there's so much more. We are actually communication specialists, and not in the marketing and the PR way. We're communication specialists. Our job is to understand how an individual communicates. And what is communication? I have an idea, I have a thought, I have an anything, and I need to make this known and understood to the next person. As simple as that. It is literally as simple as that. So our job and our role is, how do I move an idea from point A to point B? And if it gets from point A to point B and there's breakdown, who's responsible for the breakdown repair?
Yeah.
Both people, because you want the message, right? Yes. And I want to give you the message. Yes. So, and then how do we repair the breakdown so that ultimately the message can be transported from point A to point B? Okay, so that is speech therapy. That is speech and language therapy in its very basic form, As speech therapists, we are also qualified feeding therapists. Okay. And not a lot of people know this. Yes. Not a lot of people know this. So in hospital, that's why we say birth to death, from birth. I remember once speaking to a sister in the ICU, and she was saying, no, but babies don't need to speak yet. They only speak much later. And I'm like, we've really got to change our title. Because we work on feeding as well, And if you think about it, the muscles that you use to breathe and speak and eat, all the same. They're all the same, and so you have function overlaid on a system. Okay. Yes, so we do that as well. So we are speech and language therapists as well as feeding therapists. Okay. And then because you cannot necessarily communicate or speak without understanding, and a lot of understanding comes from hearing, also work on
the auditory system.
The auditory system. Okay. And not in the same way that audiologists will work on the auditory system. So audiologists are responsible for understanding the structure. They won't necessarily treat the structure. That then we go to different kinds of specialists. But they're responsible for understanding the structure and the function that is overlaid on that structure and ensuring proper functioning of the system. Right. So they are concerned with, can this individual hear? How well can they hear? What do they hear? When do they hear best? And how do we help them access hearing? Okay. All right. Okay. My job is, can they hear? If not, I send to an audiologist. Okay. And then if the audiologist says thumbs up, then I say, right, what are you doing? What is your brain doing with what you can hear? Okay. Right. Cool. So when it comes to autism, and I think, how many conversations have we had explaining autism? Quick, fast. Yeah. Quick, fast. 3 things are involved for an autism diagnosis to be made. Communication would be delayed. And guys, this communication that can be delayed looks so different for every single child. So it's a social communication barrier. Mm-hmm. Then there will be repetitive behaviors, and sometimes there are overt repetitive behaviors. Mm-hmm. So sometimes, children can play with their fingers. Sometimes it you have verbal repetitive behaviors, and sometimes it can even be internal. There's some kids who will walk into the room, and for the first minute, they just stand there. And I can see their eyes darting around, counting all the corners in the room. Okay. So those things will be present. And then the third one is that there's a sensory component. And this is why I think the definition of autism is important, the sensory component. Okay. We forget that everything we do has got a sensory component to it. Yeah. We completely forget that. And so children will come into my rooms, or parents will come into my rooms, and they'll say, he's ignoring me. And I think he can't hear And then I'm like, okay, let's go to an audiologist.
Yeah.
Audiologist says, no, he can hear.
Yeah.
And then the parent's like, so what, is he just not like me? Is he just ignoring you? I'm like,
this was our journey. I know he knows his name.
Yes.
But he's not listening to me. When I call him, he doesn't turn around.
Yes.
But I can see him focused on listening either to the TV or to the radio, or so what is going on?
Yes. And so exactly that, where then we think, okay, he can hear, so now, oh, it must be me as a parent. He mustn't like me. He must really not want to talk to me. And it's not that. Then we get into the sensory component, right? And the reason why I want to bring in the sensory component is this is where we then step in, not really to treat the sensory part, but this is where we step in as speech therapists with autistic children to understand the picture.
Yeah.
Is this child not communicating because they do not understand language? And that's not sensory, but are they not communicating because they do not understand language? They don't understand how to unlock the code that is language.
Okay. Yeah.
And the code that is language we call English, Sizulu, Sepedi. That's the code. Do they really not have the capacity and the ability to unlock the code? Is their ability to unlock this code delayed? No, but the language is fine.
Yeah.
The language understanding is fine. Okay, then is it an issue with muscles? And when we get to muscles, then sensory plays a role. If I say to this child on a picture, show me mouth, and they can point to the mouth, or I say, show me mouth, and they point to their own mouth, then I say, okay, say mama, and they can't. Parents immediately think, no, he's just being naughty. No, that child probably doesn't even know how to sensorically locate their mouth.
Okay.
Does that make sense?
No, that makes sense. That makes sense, because when I think of our journey with Oli, where we are right now is we've understood this guy knows what we're saying. He just chooses not to listen to us,
which is even more hard to understand.
He knows what we're saying.
Yes.
We can hear the words also coming out, but it's how now the muscles are actually forming these words so that they can actually be crisp to the ear to be heard. And I always say to people, just spend 10 minutes with him and your ear will actually fold to hearing how he actually speaks. But I do understand what you're saying, but the muscles haven't actually caught up to really connecting to, I hear what you're trying to have me say, but my muscles honestly
sensorically, I cannot sense how far my tongue is from the roof of my mouth. I cannot sense how much force I must use on my lips. That's why my b and my and my f will not even sound like a f, it'll sound like a that's why it will sound like that. And so there's that sensory component. As speech therapists, when we walk into a case where a child has got autism, yes, we are interested, first and foremost, with transporting the message from point A to point B. But we also have this awareness and the knowledge of, if the language is there and speech is the issue, it's oftentimes not just a speech issue the way it will be in a non-autistic child. In a non-autistic child, we also have to be mindful that because of the sensory component of autism, we have got to think a lot deeper with this specific child. And so when I do my case histories with parents, I always ask, do you have a picky eater? And they're like, no, he's not picky. He eats everything we give him. And then I'm like,
what do you give him?
What do you give him?
What do you give him? Fish fingers and chips. Because he throws away the broccoli.
You're an honorary speech therapist. You know exactly the questions. What do you give him? You know, we give him yogurt, soft. We give him bananas, soft. We give him blueberries, soft. We give him, he eats chicken. Chicken or chicken nuggets? Chicken nuggets. Soft. Exactly that, So I walk into the situation, I think, okay, this child, how are they currently communicating? And what role does sensory play in how effectively they are communicating? And I think what helps a lot of parents, what gives them that after an assessment is when I say to them, your child's actually communicating quite well.
Yeah.
You are just tuned into the wrong radio station.
And I think that was the biggest thing for us when we had that conversation, was that, no, this child communicates.
Yep.
Because he has come to 3 years old. He hasn't died from starvation.
Yep.
He's able to move from A to B because he's been able to communicate his needs to us. We just obviously then had to learn his language of communication. At that time, it is either pointing or it's either holding my hand and taking me to an actual place. But where we are wanting to be is obviously he's communicating, but he's just not using the language.
Yes, he's not speaking.
He's not speaking the words that I want him to speak. And I think for me, that was one of the biggest things as a parent that I had to wrap my mind around, is that we walk around as parents of autistic kids worried, how will my child fend for themselves in this world?
Yeah.
And all we want is for them to be able to mimic the world in order for them to be okay in the world. So as a parent, when then we have that conversation of, no, this child communicates. Yeah. He's just communicating differently.
Yeah.
And I had to sit back and ask myself, how much am I closing off his ability to thrive by wanting him to communicate in a specific way? And instead of actually saying there are many ways of communication, and how do I then impact the world to be open to that? My question then on that is, when parents come to you, and these are the things now that we have to wrap our hearts around, because I had to wrap my heart around. I had to wrap my heart around. This is the child I've been given, and this is the child that has been purposed for this world. I do not know what that looks like, which means the way that he is complete.
Yes.
And so what do the conversations look like, and what is it that you want parents to know in wrapping their hearts around on what may not happen in this space or will happen in this space of speech therapy?
I always say to parents, I'm not God. I am not God, and I'm very grateful that I'm not God, because if this is a child who will remain non-speaking, I would hate to be the one to say, no, speaking is not on the cards for this child, you know? And because I'm not God, we don't know. Yeah. We don't know. And I think for a parent, that's the scariest thing to hear from a professional, that we don't know. Yeah. We don't know. You know, there are some children who are delayed, never receive any kind of intervention, and then
it just happens.
They come right. And then there are some children who are delayed, receive early intervention, and then doesn't come right. Yeah. You know, and so we don't know, which is why we intervene for everyone. Yeah. Which is why we intervene for everyone. So the things that I would want a parent to wrap their heart around, oh my word, is that nobody knows. Yeah. And that is a very difficult thing, even for me who wants to know everything, you know. Everyone's listening to this and they think they're hearing, oh, Kali's so easygoing. Yeah. Kali is not an easygoing individual, but I've come to accept that we don't know, and because we don't know, let's wrap our hearts around going with it and going with the flow. And by flow, I don't mean an arbitrary flow. By flow, I mean let us prioritize understanding our children's cues and following our child, and that is that flow, the flow of the cues and the flow of understanding the child. Because once you start following him, start following her, you know, you actually start understanding he's going to be okay. Yeah. I don't know when. I don't know what that looks like. Yeah. I don't know how. Yeah. But because I am following and I'm watching and I'm observing, I know he is going to be okay. Yeah. That's the biggest thing. And I think I said this to you as well, and I say this to a lot of parents. Guys, there's a lot we don't know about autism. Yeah. There's a lot we don't know. There is a lot we don't know. And there's a lot we thought we knew, and now every autistic child is saying, ha, you're wrong. There's so much we don't know about these children. But what I've seen in my clinical experience, that is the most fascinating thing for me, is the second parents unlock. Yeah, you've always said that, yeah. When the parent unlocks. When the parent unlocks. The child starts to flow. Yes.
Because, and I always say this, is that, and this for me was something that I connected with when I was pregnant with my kids, is that I am carrying a spirit within me. And we are connected. We are forever connected because I literally grew their teeth. We are forever connected. Which means that when I am not in a space, or when I block, my child blocks, because I've been given the responsibility to steward this child into this world. So when my ability to not steward well, which means I'm not in a flow, I have not wrapped my heart around certain things, that thing of I don't know is the scariest thing for a parent, because how do I not know when my responsibility is to know as a parent, so I can equip this human so that they are functioning in this world? So to get to a place where you wrap your heart around, I don't know, and being unlocked. And the moment I know as our household, when we sat in that space of, this child is complete.
Yes.
This child will flow and move in the manner in which they were created to, and then trust that I have everything that has been given to me in order to be the perfect steward for this child.
And then let
go. It was as if he was showing off. It was as if he was just on some, you were holding me back. You were holding me back.
You know what it is? We keep speaking about the world. And even about in our families, we have micro worlds, right?
Yeah, we
really do have micro worlds. So with myself, I was going through a lot at a stage. You know, there was a stage where I was studying and this was happening and and my kid, I could just sense he was tense, and I'm like, what has this kid got to be tense about? What is he gonna be? He doesn't even know what his poop smells like. You know, what has he got to be tense about? And then I sat back and I was like, I'm tense. His world is anxious. And when his world is anxious, he will mirror it. And so we say, you know, we want autistic children to mirror the world and mirror the world and mirror the world. And then when they mirror our anxiety, we're like, don't do that. No, don't do that. No, they are mirroring the world. And so it's when parents eventually realize, let me breathe. Let me, you know, let me get my child help and be content. And confident, not content. Content is even the wrong word. Confident that the team you have, your child working in, is there. And when you can understand, and when you are content that, okay, we've done it. He's getting the early intervention. He's getting the speech therapy. He's getting the occupational therapy. He's eating what he can. You know, yes, the goal is he needs to eat what he needs to eat. But for now, he's eating what he can. He's safe. He's clothed. He's good. He's complete. Let me unlock. The second that happens, your parents are like, okay, I'm going to let go. The child's like, welcome. You know, we've been waiting for you. Let me show you. So these are my sea animals and these are my dinosaurs. And when I line them up like this, it's actually because I saw them like that on that movie. Remember, Mama, when we sat and we watched that movie together? I remember that scene, and that's the one that I'm reenacting. You know what I mean? And the second, parents can unlock and rest in it's going to be okay. I don't know how. I don't know when. It's going to be okay. You then can follow. And once you follow, you then start to see. Most of this kid's always been communicating. He's been complete the whole time. The whole time. And I think parents are listening to this and they're watching this, and I think it's maybe starting to sound, you know, leave them alone. It's not leave them alone. He definitely needs speech therapy, and he definitely needs occupational therapy, and sometimes he may even need equinotherapy, and sometimes he may even need music therapy, you know, and sometimes he may even need music therapy, you know, and sometimes he may need, what do you call those, earmuffs, you know, whatever it is that he needs, you get the child what they need, and you get them what they need. And you do it in a way that you can be content, that you've given your child what they need, and then you rest. and you rest in he's going to be okay. Okay.
A question before we wrap up our chat. How do I know I should be stepping into a therapy thing?
Yeah.
What can parents put their hats on or pin and say, okay, let's figure this out. Let's seek this. Because sometimes we try to Google it. We try to figure this out. We read the blogs. We give the supplements because magnesium does this.
And coconut water.
And we do all of these
Camel's
things.
milk, yeah.
Is there something that can be a trigger where you just like, even if it's an emotional trigger, not necessarily something I can physically see with my eyes. In your experience, when parents come to you, what is the common denominator of this happened or I felt like this, and as something that you can give to parents of seek the help that you need?
For sure. So first off is milestones. We speak about that we don't compare children, and I'm like, it's a very nice anecdote, and it is true. However, what is it's Franklin from My Wife and He goes, anywho. However, I like to believe that we don't compare children as far as skills and gifts and personality are concerned.
Okay.
But milestones are there for a reason. How do you know you are on the N1 towards Saturn?
Yeah.
How do you know?
Yeah. You see the signs.
You see signs, and you know, okay, after this sign, and it's going to be a bridge.
Yes.
And then when traffic starts slowing down, then I know I'm at William Mandela. William Nick Mandela Drive. I said William Mandela. There are landmarks that you need to see to know that you are headed in a certain direction. But if I'm starting to see, I don't know, what is on your way to Centurion or Pretoria?
Then you're on Pretoria. Then you're
Adams
seeing,
and Adams.
Yeah. Then it's Mall of Africa.
Mall of Africa's on your right, and then you're like, then you know, okay, something here is not headed where I thought I was headed. Okay, so parents definitely please pay attention to milestones. Yes, children develop differently, but not so differently that milestones are still not relevant. Okay, we do care about milestones. So that's the first one. Just very quickly, first word around 12 months. Personally, I don't like to leave it later than 14 months for that first word, and it's the first word with meaning. So if the child wants to say bottle, and in your guys' whole household you call it a titi, and the child says titi counts as a word. It doesn't have to be a full bottle. No. Titi counts as a word. Right. And then we have this thing, I don't know where people get it from, where they say, one word by one and two words together by two. My 16-month-old is putting 3 words together. When you understand how fast development happens, you understand there's no time to waste. So 2 words together actually needs to come at 18 months, around 18 months. Obviously, if your child's premature, those norms will change, but there are still milestones even for premature children. And then by 2, we're expecting short sentences, very short sentences. And not everything that they say needs to be in a short sentence, but there should be emergence of short sentences by that age. All right. The flags. Not responding to your name with full knowledge that the child can hear. Guys, please let us not ignore hearing screenings. Let's not ignore hearing screenings. Sometimes I work with 7, 8-year-olds and I ask the parents, when else did you screen his hearing? They did it at birth. I'm like, you know how naughty these kids are? They shove toilet paper in their ears and peas and lentils and you've got to check these things out. Okay. So up until the age of 7, guys, are hearing screening every single year. And a screening is different from an assessment. A screening is everything sharp, yes or no? And if they say no, you go and find out what's not okay and what is the degree of it not being okay. All right, screening. Right, so he's not responding to his name. And the biggest one, I just say, and I know it's not really empirical, but this is the common thread in every single case I've worked with. When a parent says, something didn't feel right. You know that gut feeling?
I know it,
I wish we could quantify a gut feeling, but when a mom says to me, something wasn't right, I took him to a doctor and we tried this, but just it just didn't feel like something was right. Never ignore that.
Okay.
Never, ever, ever ignore that. So when a child is speaking is delayed, when a child's understanding is delayed, when a child's response to their name is delayed. And the eye contact one is a big one.
Yeah.
But it's not enough.
Okay.
So Ollie gives the most beautiful eye contact.
At some point he didn't though.
At some point he didn't,
yeah.
but he gives it now.
Yeah.
And so if there's a parent who is in that situation where the child's giving beautiful eye contact,
but all the other things
are not there, they'll think, oh no, he's giving the eye contact, it can't be.
Yes.
You know?
Yes.
And so eye contact, it's not just, it can't just be it. I've met some children who give the most amazing eye contact who are autistic.
Yeah.
And I've met some children who are not autistic who don't give eye contact.
Mm-hmm.
Okay, but yes, eye contact is one of those. And then you want to look out for the sensory things. Those ones are very important as well. And I think as parents, we don't realize what sensory is. My son the other day, he was playing with yogurt. He wasn't supposed to be playing with it, he was supposed to be eating it. And I gave him a spoon because he insists on feeding himself. And he touched the yogurt and he went, and I thought, you know, that's sensory. Feeling of grass, that's sensory.
Not wanting to get wear a top and their head gets stuck and they freak out.
You quickly pick up your child and they go,
yeah.
That's sensory, you know? And so not every single sensory symptom will confirm autism, but those are the things that parents need to look out for.
Okay.
And the biggest one was when parents say to me, and this is documented with research as well, that's documented in journals, that regression period. I like to call it the Bermuda Triangle.
Okay.
We know things happen there. We don't know what happens, but things just get lost. That regression period and that's around 18 months to anywhere between 18 months to 24 months, but for some children it happens earlier, for some children it happens later. I say to parents, was there ever a time your child could do something and then suddenly it just vanished?
Yeah.
Yes, you know, he used to sing, he used to say mama, he used to say papa, you know, he even used to play. He used to, you know, go and play in his mud kitchen and he'd bring us these little cakes and then he just stopped. But you know, I think it's because I started a new job and as parents, you've noticed it. And then it just stopped. The second you say, yeah, but I think it's because I started a new job and we start to intellectualize and we start to rationalize it.
Try to qualify it.
And we try to qualify it. Yes, those things do affect children, but not that the development goes backwards.
Okay.
It is not normal for development to go backwards. Okay. And if it is not autism, but that development still went backwards, you need to speak to a healthcare professional. You cannot leave that alone. Okay. You know, he used to walk and then he stopped.
Okay.
Absolutely not. He used to talk and then he stopped. Absolutely stopped. Not. He'll say a word once and then never again.
Yeah.
No. Okay. So those are the things.
Okay. Thank you, Buhlale. Thank you. We are looking forward to more conversations that we're going to have.
Yeah.
Thank you, Buhlale. Thank you really for giving us the time. And we're going to have more of these.
Yes, definitely.
So stay tuned for more.